Botox doesn't work on me, it never lasts.
Okay, stop there. I'm going to give you and you 5 main reasons why that could be happening. All right, when Botox doesn't work, most injectors will jump straight to resistance. So antibodies, yes, that's one of the causes, but it's not a very common cause. Number 1, and this is probably the most common cause, you have underdosed for that individual. Now, the way injectors are often taught how to inject is a cookie cutter approach. Now, a good example of this is men versus women. If you're blocking a bigger engine, not a different engine. So essentially, there's just more muscle to block. So you have to tweak your doses and technique accordingly. Number 2, you have a very fast metabolism. Metabolism doesn't actually stop the Botox from working, it just reduces its lifespan. So you're going to need it more frequently, or you can do something called double dosing where we inject more. But again, that comes in with its own risk and higher risk of side effects as well. Number 3, the muscle has adapted. Now, muscles are clever. They work on feedback loops, and it's not that they develop resistance, they just become smarter in circumnavigating this drug that it knows keeps repeatedly coming back every few months. And these clever little things come up with different ways. They start recruiting more nerve fibers. They start redistributing the movement. They regain function faster. And this is seen more frequently with repeated injection patterns and doses in the exact same area and static dosing over the years. In simple terms, your face learnt a loophole. Number 4, nutritional issues. Now, the neuromuscular junction has multiple influences working on it. The botulinum toxin drug is just one such thing. If you have deficiencies in certain cofactors and vitamins and minerals that have a key role, such as zinc, you may find the exact same thing is happening. It's wearing off. And number 5, finally, true immune resistance. This is the rarest type. Some patients, repeated exposure again and again, frequent top-ups lead to neutralizing antibodies right at the source. This is not wearing off. This is true inactivation. So before we start fear-mongering and getting scared, let's clarify a few things. 1 bad experience does not equal resistance. Shorter duration does not equal resistance. Needing more units does not mean resistance. And now that you understand this, you can understand why I am so against preventative Botox. If the muscle isn't causing an issue, if the line doesn't exist, then why are you starting early and exposing the muscle for a longer lifespan unnecessarily when you know those above reasons can take place at any point?